So for abstract, our critics look at study by Zhang that compares intermittent fasting, which is IF, with continuous energy restriction, which is CR, in people with metabolic syndrome. The study shows that IF is slightly better for weight loss, lowering BMI and improving triglyceride, while other results are about the same as CR. We also notice some weaknesses, like short study periods and only using English paperworks. And considering the differences in ages and gender. Overall, the article is really useful, but we think uh, longer and more diverse studies are more needed to really confirm the long-term benefits of intermittent fasting.
The objective of this article is to compare the effects of intermittent fasting and continuous energy restrictions on obesity, glycolipid metabolism, and individuals with metabolic syndrome under comparable calorie intake. For the methodology, a systematic review and meta-analysis 9 randomized control of trials involving 626 participants and 9 RCTs from database analyzed via PCOS in R software. For the result, there is no significant difference in BP, glucose, insulin, and fat mass. In conclusion, intermittent fasting was more effective than continuous energy restriction in improving weight, BMI, and triglyceride levels in metabolic syndrome patients. For the limitations, the study was limited by short duration, self-reported data, and exclusions of non-English research.
So the part on critique on introduction, the study compares intermittent fasting, which involves eating only during specific time windows, with continuous energy restriction, which means reducing calorie intake consistently throughout the day. The focus is on people with metabolic syndrome, which is a cluster of health problems like obesity, high blood pressure, high blood sugar, and unhealthy cholesterol levels, all of which raise the risk of heart disease and diabetes. The study's goal is to see which diet method is more effective in improving obesity and glycolipid metabolism. That is how our body handles sugar and fat, and importantly, both groups consume the same numbers of calories, so the comparison focuses on the pattern of eating, not the amount. In terms of critique, the introduction clearly connects the study to a global health issue. It highlights the growing prevalence of metabolic syndrome and explains the role of energy restriction, meaning reducing calorie intake as a common strategy to manage it. What makes this study interesting is its specific focus. Many past studies only look at weight loss, but this one looks at deeper metabolic effects like blood sugar and fat regulation. That adds originality and relevance to the research. Finally, the introduction gives enough background for readers to understand the topic. Even if they are unfamiliar with IF or CR, it also explains why a meta-analysis, a method that combines results from multiple studies, is needed, due to conflicting evidence in existing research.
Hello, now we will look into the research methodology that this research is using. It used the systemic review and meta-analysis that it compared the effects of continuous energy restriction (CR) and intermittent fasting (IF) on metabolic parameters in people with metabolic syndrome. So, the methods they use are adherence to PRISMA guidelines, prospective Prospero registration, dual independent reviewer screening, and also an application or random or fixed effect model based on the quantified heterogeneity of I-squared statistic. So, what are the critiques arise on this methodology they use? The first one is about the language bias. This research only limit towards only English language articles only, but it does not include other language articles. So this being made as a relevant data being excluded from it. So what should be done is actually to make sure the generalizability and also reliable sources such as Cochrane systematic reviews that highlight a thorough literature search free from language limitation. The second one is about the predominance of short-term material. This research only have a short-term trial where it's a less than 12-week duration within the included studies that present another significant limitation of this research, reliability. So it is already contradicted with the long-term randomized control trial RCTS that prioritize follow-up duration exceeding 52 weeks to assess the sustained efficacy and safety. So the reliance on short-term data in this research limits its validity of the claim regarding the comparative long-term effectiveness of IF and CR. The third one is about data verification. It excludes some variables such as concurrent exercise routine, dietary macronutrient composition, modifications, and the degree of metabolic dysfunction of the people. They should include the meta-analytical approach like an individual participant data meta-analysis that can offer an improved reliability and yield more nuanced and therapeutically applicable findings toward this research.
Now, let's take a look at our critique of result. First, intermittent fasting is non-inferior to continuous restriction for weight and BMI reduction because there's a study found that there is no big difference between those two when it comes to lose weight. This means that intermittent fasting works just as well as continuous restriction for weight control. The researchers also say that things like how well people follow the diet and how their bodies react are probably more important than the type of diet itself. Secondly, intermittent fasting more effectively reduces abdominal fat. The study showed that intermittent fasting helped people lose more belly fat and reduce their waist size better than continuous restriction. Even though both groups lost about the same amount of weight, intermittent fasting seemed to help more with fat around the stomach, which is more dangerous to our health. Scientists also still need to study why intermittent fasting works better in this area. Third, intermittent fasting improves insulin sensitivity. Intermittent fasting improves fasting blood sugar, insulin levels, and something called HOMA-IR, which tells us about insulin resistance. This means intermittent fasting helps people's bodies use insulin better. However, there was no change in HbA1c, a marker that shows long-term blood sugar. That might be because the diets weren't followed for a long enough time. And for the last one, intermittent fasting lowers LDL cholesterol but doesn't significantly affect other lipids. Intermittent fasting lowered LDL cholesterol, the bad kind that's linked to heart disease, but there was no changes in total cholesterol, HDL, the good one. This means intermittent fasting may have a specific effect on LDL only, or that we need more time to see other changes. Also, what people were eating before the study can also may affect the results. To sum up, intermittent fasting is a good option for people with metabolic syndrome.
Next, critics element discussion. First point is missing gender-based analysis. For example, the article does not talk about differentiation between male and female participants. Male and women have distinct hormonal profile affecting their metabolism and fat loss. Prior research indicates sex-specific responses to intermittent fasting, which this study fails to explore. For second point, age-related differences overlooked. No subgroup analysis based on age group, such as young adult versus older adults. Older individuals are at risk of muscle mass and hypoglycemia during fasting. Age affects metabolic rate and dietary tolerance, so finding may not apply universally. So for third point, consequence of generalization, treating the sample as homogeneous oversimplified the effect of dietary interpretation. So lastly, for recommendation, future studies should include stratified or subgroup analysis to better understand how IF and CR affect our metabolism. And lastly, this would enhance the precision and relevance of dietary guidance in real-world practice setting.
Hello guys, I will continue with the conclusion for critique elements. Based on short-term studies, intermittent fasting shows comparable and in some cases slightly better outcomes than continuous restriction. This includes reductions in waist size, body fat, and improved insulin sensitivity. However, these findings are limited by relatively short study durations and the lack of subgroup analysis across different ages, genders, and baseline health conditions. Because of these gaps, it's too early to declare a clear winner. What we can say is that both IF and CR are effective when total calorie intake is controlled. So, what's the takeaway? Intermittent fasting is a promising short-term alternative to continuous restriction, but the best choice ultimately depends on your lifestyle, preferences, and consistency. Going forward, we recommend longer-term studies involving more diverse participants to better understand the full impact of these diets.
Okay, to conclude our research, intermittent fasting seems slightly better than continuous energy restriction for weight, BMI, and triglyceride. But the study's short duration and limited scope mean we can be sure of its long-term benefit. More diverse and longer studies are needed to confirm its real name.